Hello, everyone. We're just starting, and apologies. I've got Dr. Kelvin Memeh not joining us today. Apparently, he's going to be unavoidably absent because of certain reasons. So we'll reschedule for his own session separately. So it's only going to be Dr. Ndong that will be speaking to us today, and I will introduce him right away. So, Dr. Ndong is a medical doctor and a public health specialist. He's currently a general surgeon and assistant professor at Gastembaga University in St. Louis, Senegal. After completion of his general surgery residency in Dakar, he trained in laparoscopic surgery at Queen Mary University of London. He participates regularly as a volunteer in surgical campaigns for disadvantaged populations and is particularly interested in minimally invasive and global surgery. He also aims to participate in training the next generation of surgeons in Africa and in Senegal. He hopes his efforts will give communities better access to surgery. Apologies for the background. Sorry, I'm coming back from a conference and I'm just in transit. So ignore my background. I'm going to go muted now, and Dr. Ndong would have the stage. Over to you, Dr. Ndong.
Thank you very much. Hello, everyone here. I'm Abdourahmane Ndong from Senegal. So I'm very happy today to participate to this session of mentoring and I'm sorry, I'm alone at home with my young daughter here. Come and say, viens dis bonjour. Maintenant, va t'asseoir là-bas, tu vas me déranger. I'm sorry. I'm here today alone with my daughter, but I'm going to share my screen and to start the presentation, which will be about general surgery training, particularly in Senegal, and how it is going, and what kind of training are done, and how an international medical student would do to be part of this kind of training path in my country. And before starting, I just wanted to tell you also that Senegal is a French-speaking country. So if my English is not like your English, I just wanted to tell you that it's only because English is not my first language, but I will do my best to do the presentation for you today. Just to confirm, can you see my slide? Can you see my slide? Can you confirm that you are seeing my slide, please? I'm not share your screen. Oh, you are not seeing my slide yet. Is it okay now? It's like it's lagging a little bit. If it's working now, you can tell me if you are seeing my screen. Uh, slide. People are not seeing my slide. I don't know why. Let me check again why people are not seeing my slide. Yeah. Okay. Sorry. I will discuss.
Dr. We can't see we can't see the slide yet. Okay. I think he's logging in.
Yeah, I think it's lagging a little bit. So can you see my screen now? Can you see my screen?
Not yet. I think it's lagging, but I think it's almost gonna come up now.
Yes. Yeah, I think it's lagging. Yeah.
Can you also
I don't know what is the problem, but
see the
I have already shared my screen. Uh, Sorry for the delay. I don't know why it's not working. Let me stop and start again.
Can everyone hear me?
Hello everyone, I'm back. I'm
Yeah,
trying again.
I think it's yeah, we can see your screen now.
Yeah, you can see the screen now.
Yes, yes.
Oh, cool. That's cool. The slides. Can you see the slide?
Yeah,
Yeah. So I can start.
yes, please.
Okay. So thank you very much. Thank you very much for being here today. I'm very happy to be here and to share with you my little experience in general surgery training in my country. And I hope that after this presentation, Fatima, I hope that after this presentation, all people who are here will be very keen to visit my country and also to visit our hospital and university to discover how we are dealing with all the same challenges in sub-Saharan Africa, but also in the world in general. So my name is Abdourahmane Ndong. I'm from Senegal. Senegal is a West African country. I'm pleased to introduce today's topic, the general surgery training case in Senegal. Know that the field of medicine has always been a vital component of any healthcare system, and surgical care plays a significant role in ensuring the well-being of a community. However, there is often a shortage in of well-trained surgeons, particularly in developing countries, particularly in sub-Saharan Africa and in my country also. In this session, we will discuss the detail of the general surgery training program in Senegal, including the educational and professional requirement, but also the advantages to be trained in surgery in Senegal, the timeline for obtaining the training position, and collaboration with local and international institutions. So let's just delve into the topic and explore the opportunities and challenges of surgical training in Senegal. So we are going to use this plan. We will be talking about the background, and after that, talking about the health system in general in Senegal. After that, the health education system. And after that, talking about all the surgical specialty trainings that are available in Senegal and how to access to those surgical training. And before concluding, I will tell you just a little bit about our residency program in general surgery here in Saint Louis in our university. When we think of Senegal, most of the time it's football and jollof rice that might come to our mind. You know that recently United Nations determined that jollof rice originated from Senegal and not Nigeria, not Ghana, and not also as a West African country. So when we talk about Senegal, most of the time we think about jollof rice, but also about football. We are the African champion about this sport, and also Senegal has so much to offer in terms of travel destination. We have very stunning beaches in Sali, and I think that Senegal is a good destination for someone who want to explore those cultural elements. But also what we are going to talk about this presentation is about our health system and our surgical residencies program. So in introduction, we can also say that Senegal is a low-income country, so a developing country. We have something like 15 million of people in the country. And in terms of in terms of medical education, Senegal is the location of the first medical school in West Africa, in French-speaking West African countries. And this school was founded in 1918 and has played a critical role in training medical professionals, not only in Senegal, but also in neighboring French-speaking countries like Mali, Guinea, Togo, Benin, and Burkina Faso. And despite being a low-income country, Senegal has made significant strides in providing accessible and affordable healthcare to its citizens. The country has developed a strong network in public hospital and clinic, which offer a range of medical services to its people. Senegal's location and history have also made it a hub in terms of medical research. And we have something like 14 medical regions and 76 health districts. And despite all those good points, we are lagging in terms of number of physicians and surgeons. We have less than one physician for 10,000 of people, and we have also an unbalanced repartition of medical doctors and specialists that are mostly located in the capital, which is Dakar. And about the health education system in Senegal, public medical schools are the primary source of physician training. So in Senegal, there are 5 public medical schools that offer a 7-year medical doctor program. And after completing the 7-year medical program, a physician may choose to specialize in surgery. And the surgical specialization program take between 4 and 5 years, during which time they receive comprehensive training and hand-on experience in surgical procedure. Subsequently, some physicians also may choose to pursue subspecialization in particular field and to do a master's degree or a postgraduate diploma when it's available in Senegal or abroad, mostly in France or in Belgium. Here is the list of the surgical specialties that are available in Senegal. So we have general surgery. I did my residence in general surgery. It's the oldest training path that is available, and we have also pediatric surgery, surgical oncology, obstetrics, urology, orthopedics, neurosurgery, ophthalmology, and stomatology. Some particularity also, in Senegal, we have the training path about surgical oncology, which is the only one training path available in French-speaking country in Senegal. So if you want to be a surgical oncologist and you are from a French-speaking country, most of the time you come to Senegal to do that surgical specialty. After doing the surgical specialization in 4 or 5 years, you can, if you want, achieve through a 1 or 2 year postgraduate diploma subspecialization like in laparoscopy or in vaginal surgery. But there are also some kind of master degree if you want to do fundamental research like in genetic, histology, anatomy, and also in public health. The particularity of this postgraduate diploma in Senegal is that you can do it during your residency. So you do not need to finish all your 5 or 4 years of residency to start, there's postgraduate diploma. So you can, if you want, do it during your residencies. So you see here, we published recently an article about the limitation and the challenges about laparoscopic surgery in terms of training, but also in terms of taking care of patient at the hospital. If you want, after, you can go through it and see our little experience about it. And how to access to the surgical specialty for a national or an international medical graduate. So after completing the medical doctor program, the 7-year, medical graduate can participate to a national residency contest known here as Internat des Hôpitaux in French, and it's open to all medical doctor. But you can do it after you finish 5 years of medical school. So before you finish your medical school, you can do that context and start your specialization if you want. So it's a very particular system. So you will see in our country people who have not finished their medical school but have started their medical specialization. It's a very particular path that is helping also to train people who will be teachers in the medical school. Particularity also, this context is open to all national but also international medical graduate from Morocco, from Benin, from Mali, or from all other country in West Africa can come and participate to that contest. And for international medical graduate seeking to practice in this country, in Senegal, there are also eligibility requirements, but generally no exam are required. Applicant must submit an application, and if they are accepted, they can begin practicing medicine and doing their training. For African graduate from countries within the Economic Community of West African States, ECOWAS, there is no need to have a visa or to have a work permit. So it's really open to all people who are in West Africa and who want to explore more in terms of surgical training to come in Senegal. So what about the timeline to obtain a position as a surgical resident? The timeline in the country generally begin in August and September each year. And this is a period where medical graduate can apply for residency program position in different medical specialty, and medical graduate are generally encouraged to apply early to increase their chance of being accepted into their preferred specialty. The application process generally include the submission of academic transcript, a CV, and letter of recommendation. And once the application period has closed, the selection process begins. The selection process typically involve reviewing the applicant academic performance, extracurricular activities, and letter of recommendation. And after the selection process is completed, successful applicants are notified, and training generally begin in October each year. And medical graduates who are accepted into residency program are expected to complete their training over a specified period and meet the program requirement before they can graduate. There are also some exchange program you can do during the residency to go abroad and do some internship. You know that Senegal is also part of West African College of Surgeons, but most of the surgical residency program are not part of the training program of West African College of Surgeons. It's not the case at this moment, but we are working into it because you know that we do not have the same university organization, and we do not share the same language of study. That's why most of the French-speaking countries do not are not part of the West African College of Surgeons training program, but some hospitals are accredited by the West African College of Surgeons, and if you are a resident from a WACS country, you can come in Senegal in those departments, those hospitals, to do some of your training. And for those who speak French, you can do during your residency also 1 year or 2 years of your training in France or in Belgium. It depends on your on the board of your specialty, and if you have a good a strong if you show if you are very keen to learn more, you can apply for this kind of program and go abroad, like in France or in Belgium, to do an exchange program, and it will be accepted by your surgical residency board. Before concluding, I wanted to give you some advantages or benefits of medical training in Senegal. In Senegal is a rich cultural and historical country. And firstly, the country offers an overview of local culture, which is essential for medical professionals to understand the social and cultural factors that influence healthcare delivery. And I think this understanding of the cultural background is vital in providing patient-centered care that is respectful of patients' cultural belief, value, and practices. And secondly, cultural immersion is also important for medical professionals to gain a better understanding of the local community's health need and challenges. And this experience is crucial in preparing medical professionals to work in diverse healthcare environment. Also, collaboration between local and international institutions is a significant benefit in medical training in Senegal. So this collaboration allows medical professionals to gain exposure to different healthcare practices and medical perspectives, which can improve the quality of care provided. And furthermore, the country's official language is French. So medical professionals who train in this country have also the opportunity to improve their French language skill. I know that you will tell me that the most spoken language in the world is English. Why do you need, if you are an English speaker, to go to do your training in a French-speaking country? But I think that if the more you are exposed to languages, the more you will have opportunity to go and to learn more from the other. So this language exposure is beneficial in providing medical care in French-speaking countries and collaborating with French-speaking healthcare professionals. And lastly, the country has a diverse patient population that improve medical professional with exposure to a variety of medical conditions and disease. So this exposure is valuable in improving your diagnostic and treatment skill, and probably will prepare you to work in a diverse healthcare environment. So also, before concluding, here in Saint Louis, where I am working as an assistant and as a surgeon. So Saint Louis is the second city in Senegal. So it's like 230 kilometers from Dakar, which is the capital. And historically, there was only one surgical residency program which was located in Dakar. And you know that to improve the access to training and the access to healthcare to the population, our university opened in 2020 a surgical residency program. So this program is currently in its third cohort and has welcomed surgical residents from Senegal, Guinea-Conakry, Burundi, and Cameroon. And the program is a collaboration between University of Saint Louis, Gaston University, but also other universities in Senegal, in Mali, Niger, and Chad, as well as international universities as McGill University in Canada or Toulouse. university in French in France. So you see here the an aerial view of Saint Louis. So Saint Louis is known like the African Venice because it's an island between the river you can see here and the sea. So it's a very beautiful part of the country, and I would be very happy one day if you can come to visit me here. And our surgical residency is mainly focused on using simulation before doing surgery on patients. So we are doing our best to use virtual reality. So here you see one of our surgical residents using their virtual reality headset to be trained in a case of pneumothorax. And here another surgical resident using with his head camera doing some simulation of an intestinal anastomosis during a simulation case. So we are doing our best to use simulation with cost-effective material, but also we want to develop everything that is oriented to virtual reality in health and particularly in surgery. I will be very happy if I can welcome residents from other part of the world, but also other part of Africa. We are open if you want to visit us for an internship or for observership or to do your training. You can just email me on email or email one of my colleagues. So you will have the authorization to come to do your observership. And I think that those kind of observership will be will give benefit for both to you, but also to us. But because we will learn from you, and you will learn from us, and discover another kind of surgical environment. And to conclude, you can take here my contact if you want, my email and my phone number with this QR code. And before concluding, I wanted also to thank everyone who is here today, and to tell you that I am very honored and very, very happy to do this presentation. And thank you to everyone. Thank you. I don't know if
1, 2, 3, 4, 5, 6.
Are you so you can take my contact using this QR code. Thank you very much. It's like that. Yeah. Yeah. So if you have question, you can ask your question in the chat. And yeah, thank you, David. And like I said in the beginning, I'm sorry for my English. I'm doing my best, but my primary language is French. So it will be my pleasure to welcome you also, or to learn more from you if you want to develop your French also. I want also to develop my English. So thank you, David. Thank you, Bolanle. If you have questions, you can write it on the chat. C'est pour toi. Yeah, so it's like I've seen one question here from David. How is the female gender representation in surgical training and practice in Senegal? So yeah, thank you for the question. I think it's a very important and very interesting question. And I would say that it's the same as in other countries in sub-Saharan Africa, but also in the world. I would not say that women are not represented, but if you take the ratio, I would say that you will have one woman for something like four men or six men. But it's not only in surgery, but in medical specialty, in other, not only in general surgery, but general in all the surgical specialty. But there is a change in the last year because I have seen a lot of people, a lot of female in our residency program. For example, for our residency program in Saint Louis, we have something like 20 residents. No, we have we have 18 residents, and we only have 2 female surgical residents. So you see that they are present, but they are underrepresented in terms of proportion. It's a very interesting subject because I can tell you if you want, I will tell to Oluwasina, if you want a presentation about surgery and female gender representation in Senegal, I think the most the person who will be very keen to do that presentation is one surgical oncologist I know, who is now doing his her training in UK. So I think that after it will be very good to ask her to come and to do a presentation about this. And I think it will be a very interesting and nice topic to discuss with all the other medical student and surgical resident. I don't know if I have answered to your question. David, yes.
Thank you for the question, David. And thanks for the answer, Dr. Ndong. Do we have any other questions? Just drop your questions in the chat box. Dr. Ndong is more than happy to take as many questions as possible. So David just replied that thank you. I think he's happy with the answer.
Yeah,
and any other
as
questions from
I
the?
told you.
Any other questions
Yeah,
from the
if you
audience?
want if you want a presentation on that subject, just tell me. I will send you the contact of that surgeon who is very engaged in surgery and gender female gender representation.
Okay, yeah, that would be nice. So
Yeah.
I'll just give us a few more minutes in case there's any other person that is typing a question. So thanks again, Dr. Undong, for the awesome presentation. This is session 1 of this mentorship series. Apologies again on behalf of Dr. Kelvin Memeh, who couldn't make it to the presentation today due to unforeseen circumstances. He's promised to make it up to us, and we would arrange another session for him to speak to us. Next week, we would be having another set of awesome speakers. that will be talking to us on the same topic, and that's going to be the session 2, and hopefully we would all gain one or two things from their expertise and from their wealth of experience. Before we call it a day, let's all remember to fill the feedback form, and if after I haven't posted a feedback form here, everyone that has attended would get it sent to their email. If you don't get it filled, we won't be able to know what we've done well and what we've done wrong, what we need to sort of improve on, and so on and so forth. And also, that would also get you a certificate once you put in your feedback. Okay. I think there is a question in the chat box now from Mawa. Thank you for insightful presentation. How could we improve our skills and help other colleagues in our country by collaborating with international society? Is Dr. Ndong still there? I think he's logged out. Let me have a look. Yeah, he's still logged in. Dr. Ndong, can you see the question? You need to unmute your mic. We can't hear you, sir.
Yeah. Can you hear me now?
Yes, we can hear you now. Did you see the question? I just read it out.
Yeah. There is a question here asking if how could we improve our skills and help other colleagues in our country by collaborate with international society. So I think it's an very important topics, and I would respond saying that one day I heard a quote from Paul Kagame saying that we young African, we have to seize any opportunity available for us to improve our situation. So I think that it's very important. It's a very important state of mind. So do not minimize the opportunities that are available. Most of those opportunities are here, but most of the time we neglect them or do not want to participate on it. That's why I think that it's very important to participate in any kind of opportunity you see in terms of surgical training. And do not surgical training or medical training in general. Do not only focus on gaining clinical skills. So you need also to do your best to gain all the kind of skills that are not always taught during your training at medical school. But because if you see at medical school, most of the time we are well trained to be good doctor, we are well trained to be good surgeon. But what about managing skills? What about leadership skills? What about learning a new language? What about how to deal with problems, how to deal with conflict in a professional environment? All those skills have to be learned for people. So that's why I think that we medical student or surgical resident, we do not have to only focus on gaining clinical skills or surgical skills. Those soft skills are very important, and do not neglect any opportunities that can help you to gain those skills. It can be online or doing some internship, some observership, some activities to help your community and to be part for in all the big organization like Surgical Interest Group for Africa. So I think take any opportunity available for you, and do not minimize or neglect any opportunity you see online or in your country to help other people on and to help as a medical student. That's what I would say in terms of improving your skills and helping your colleagues to collaborate with international society. So you said also to improve surgery field as we lack in facility and limited resources country. Yeah, you know, when we have a problem like limited resources or limited human resources, we have two choice. You can take it as problem or you can take it as opportunities. So if you take it as problem, most of the time you won't face those problems or you won't change it. But if you take it as opportunities, you will see it like there is something to do here, and I am in a position that I could change that situation. So if you see the situation in this point of view, I think that you can do very, very interesting things. Just an example from my own perspective. When I started my practice in Saint Louis, you know, I told you that Saint Louis is not a primary city in Senegal. The capital is Dakar. And when I started my practice in Saint Louis, we didn't start it minimally invasive surgeries in Saint Louis. So we were not doing laparoscopy for anything. All the kind of surgery we were doing were open surgery. And the paradox of that was that in the hospital, the material, the laparoscopic column was available, but the surgeons who were here, most of the time, they had an overload of patients, and they did not have the time to use laparoscopy and fight to have the equipment to complete the column. But when I was there, I've seen it like an opportunity to develop an activity that wasn't available there. So, and I did my best to start that activity with some of my mentor, Professor Konate, Dr. Jao, and Dr. Aja Kumajalo. And we did our best. And now you see, I can say that 3 years after that, Saint Louis is becoming one of the center in terms of minimally invasive surgery in Senegal. We are not doing very extraordinary things, but we can say that minimally invasive surgery is available now in Saint Louis. So that's why I'm saying that if you have problem in terms of lack of resources, just see it like an opportunity to develop more, and not only seeing it like a problem that you will have to face and something that would not help you to advance more in your career. I don't know if I have responded, but it's how I see it in my personal perspective.
Thank you, Dr. Ndong. In the absence of
if you
no
have
further
other
questions, I
questions,
think it's safe.
David or Marwa, I think we have those two people here. Thank you very much, Marwa. And I'm waiting for you to visit Saint Louis. And I will be very happy to visit your country also. I don't know you are from which country, but I really would like to visit other countries in West Africa. So I hope one day you will be my host there. So also. Ah, nice. You are from Libya. I would be very happy to visit Libya. I hope one day I will be there.
Thank you. Thank you once again, Dr. Ndong. I think it's safe to call it a wrap on these notes. No further questions. This is a recorded event, so every other person, if you've
Yeah.
missed some parts, you can go back to it later on and watch it.
Yeah.
So you would have access to it later on the Medal platform. And once again, remember to fill the feedback forms so that we know what we're doing rightly and what we need to improve on. And also, that's going to get you the certificates for attending these events. And like I said, this is the first session of the event, and subsequent sessions will come in the forthcoming, come up in the forthcoming week or weeks. Um, Once again, and for the very last time, apologies for on behalf of Dr. Kelvin Memeh, who couldn't join us today. We'll get him to join us in the subsequent weeks. Thank you very much, and have a good day or
Yeah.
night, depending on the part of the world you are.
Yeah.
Goodbye,
Thank you
everyone.
to Marwa, to David from Nigeria, to Joshua also from Nigeria. Thank you very much. Au revoir. Au revoir.